Good morning to everyone. Myself Varalakshmi.K. I am working as a nursing tutor in E.S College of Nursing. Now let's see about the osteoporosis. Osteoporosis is a systemic skeletal disease and characterized by low bone mass and microarchitectural deterioration of the bone tissue that leads to the increased bone fragility and susceptibility of the fracture. And causes drugs heparin, ethanol, methotrexate, glucocorticoids, tetracycline and caffeine, antacids, nicotine. These are all the drugs maybe causes the osteoporosis. And genetic, chronic illness, rheumatic arthritis, diabetes mellitus, cirrhosis of liver, sarcoidosis, renal tubular acidosis. Then disease, prolonged bed rest or inactivity, prolonged casting or splinting uses and paralysis, space travel, etc. Diet, decreased calcium, protein, vitamin C in diet, and the alcoholism, anorexia nervosa, and then malnutrition, malabsorption, excessive loss of protein. Third degree burns or chronic renal failure. These are all the causes, maybe causes in the osteoporosis. Then causes neoplasms, bone marrow tumors, endocrine disorders, hyperthyroidism, increased glucocorticoids and estrogen, Cushing disease. And clinical manifestation, sudden onset of the snapping sound hears when bends to lift something, sudden pain in lower back, back pain related to the trunk, increased deformity, kyphosis, loss of height, decreased exercise tolerance, thin skin, spontaneous wedge fracture, markedly aged appearance and brittle hair. These are all the causes, maybe clinical manifestation in the present in the osteoporosis condition. And diagnostic evaluation, need to be taken the laboratory values, serum calcium, serum phosphate, normal alkaline phosphate, urine calcium increased, GIT calcium absorption increased, total plasma protein is low, plasma albumin is low, X-ray, densitometry, neutron activation, bone biopsy. These are all the diagnostic evaluation taken. Then move on to the management. High protein diet, make the patient to rest, as a patient to the rest, and analgesics and anti-inflammatory drugs, supportive devices like Wells, collar and the etc. Estrogen supplement, it preserves the positive calcium balance by bone remodeling, and transdermal estrogen treatment, calcitonin treatment injection 50 to 100 international unit 3 to 7 times per weekly. Editronate sodium dihydronyl, a biphosphonate, inhibit osteoclast mediated bone resorption. And then calcium and the vitamin D. Fewer than half adults take recommended amounts. Higher risk, malabsorption, renal disease, liver disease, and calcium and vitamin D supplementation shown to decrease risk of hip fracture in older adults. 1000 mg per day standard. 1000 mg per day is postmenopausal women as osteoporosis. Vitamin D 25, 400 international unit per day, at least to 800 international unit per day. And then calcitonin, likely not as effective as biphosphonates, 200 international unit per day alternating NAS, decrease the pain with acute vertebral compression fracture. And then bisphosphonates, decreased bone resorptions, prevents fracture, aldironate and the risodronate. IV pamidronate, zoledronate, usually used for hypercalcemia of malignancy, malignancy related to fracture, and multiple myeloma related to osteopenia. Ibodronate, bone via once per month. Estrogen replacement, reduction in bone resorption, raloxifene, selective estrogen receptor modulators to use a osteoporosis treatment. Then parathormone, teriparatide, side effects, hyperparathyroidism and osteoporosis, intermittent PTH, overall improvement in bone density, and complications, spontaneous fracture will be occur, and the shock, hemorrhage, fat embolism and the death. These are all the complications under the osteoporosis. Then prevention, adequate intake of calcium and the vitamin D supplementation, and regular weight bearing exercise, and avoidance of tobacco and the alcohol abuse. And nursing management, more to the nursing management, check patient's skin for redness, warmth and new sites of pain which indicate new fracture. Encourage activity, perform passive range of motion exercise and active passive exercise and impose safety precautions. Advise to patients sleep on a firm mattress and avoid excessive bed rest. Teach the patient good body mechanics to stop before lifting anything and to avoid twisting movement and prolonged bending. Thank you.